Hi, welcome back to the channel. My name's Claire and I'm a senior lecturer in physiotherapy. And in this video, I'm going to talk through how you do a thematic schema for your qualitative data analysis or synthesis for your qualitative literature review. So, where does that sit in terms of the overall steps that we're going through? Well, this is really around step number 7 because it's part of your data analysis and synthesis specifically for a qualitative review. So by now you should have your themes, and I'm going to say that this thematic schema, it really is optional. You don't have to do this at all. But what I tend to find is the students that do this just are able to think a lot more critically about the results, how they all sit together and how they answer that research question. But I say again, you do not have to do this. This is just optional, and I'm including it in case it's of interest to you and you would like to include it. So this is about if you want to turn your themes into a schema, which is just a fancy way really of saying a picture or a diagram to help explain your findings. But I do tend to find it probably helps students just get that little bit more depth with their discussion. So the best way to show you is to just give you a few examples. So this is an example of a schema from one of my earlier studies. So this was around illustrating the conceptual interactions in relation to older people's adherence to community-based group exercise program. So this was around the fact that, having a humanizing environment was really at the heart of that, and all those other things around it interacted with that to various degrees. So that was an example of a way that you can explain your results. This is from another study that I did. So, this was a thematic schema of supporting people at risk of falls in self managing falls prevention. And so, really, I found that there were kind of two parts. There were the parts that were within the scope of the physiotherapist. So, they could take person centered approaches. They had that patient practitioner, family practitioner relationship that was important in supporting self managing falls. There was a practitioner collaboration where they collaborated with each other to support patients in what was best practice for them individually with their falls management. But then actually the therapist found there was stuff that was beyond their scope that really was a responsibility of the patient or were, by the constraints of the service delivery. So that's just another picture of a way to be explaining those results. And then this is a thematic schema, and this is around the challenges in supporting transition to community run programs. So, people will do a falls rehab program as part of their referral to the NHS service. But then when they finish that, actually, how do we help people transition to community run programs so that they can maintain that physical activity and not just stop when the intervention finishes. So this was the challenges in supporting transition to community programs. So there was a difficulty around getting patient buy-in to doing any sort of transition, practitioner awareness of the local programs and their buy-in, and then there were things around the patient suitability and the program availability. So again, just another example. And so the way you get there generally is you write the names of your themes on post-it notes, and then you kind of move them around until they make sense and you feel like they're telling a story in relation to your question. I find this is a really great thing to be bringing to your tutorials that you'll be having with your lecturers. And you'll say, okay, these are the themes. This is kind of how I think they relate. What do you think? And actually get feedback from your lecturer and from your peers, because you'll have to explain your themes really well, which means if you can explain it well, you can probably write it well. So that helps you with your write up. But actually getting input from other people then develops your thinking a little bit further around those analytical points that you want to be making in your discussion. So it's really not rocket science. It's just you write your themes on post-it notes, move them around until they make sense, until they tell a bit of a story in answer to your research question. So if you want to, please feel free to have a go with doing that. It's, as I say, it's not essential. It is an optional thing, but it can be helpful. So I offer it as a suggestion. Thanks for watching.